Hi, I'm Kim Piazza. Today we'll be talking about a breakthrough in the treatment of those suffering from continued spinal-related neck, back, extremity joint pain, and the debilitating nerve pain known as neuropathy. Conditions including arthritis, sciatica, stenosis, disc bulges, and herniations are an ongoing problem for so many. Pay close attention as we speak with a doctor who has created a revolutionary method of treatment and care that has brought thousands of people not only pain relief, but has helped them regain their quality of life. This breakthrough has eliminated pain-masking medications, painful corticosteroid injections, and even surgical interventions. Today we welcome Dr. Christian Miliotto, a leader in advanced medicine and treatment for those suffering from all forms of chronic pain. Dr. Miliotto has an extensive background working with patients at ECMC and Dent Neurologic, as well as being one of the only doctors in our region who is certified in advanced management of spinal neuropathy-related disorders. Dr. Miliotto is fully certified by the International Neuropathy Association and International Disc Education Association. His practice is called Western New York Pain Relief Center. Welcome, Dr. Miliotto. It is a pleasure to speak with you today on this topic of managing pain.
Thank you so much for having me. It's truly an honor to speak with you and all those watching.
Doctor, it seems as though most people at some point in their lives will suffer from chronic pain. Why is that?
Well, it all starts with the spine. More than 90% of people are going to experience pain in their neck and back at some point in their life. The problem with that is 8 out of every 10 people, research has shown, will continue to deal with conditions that will continue to worsen over time. Back and neck pain is not something that people should take lightly. You have to do something about it. The problem with these conditions is many times when they're left untreated, they will continue to worsen to the point where somebody needs surgical intervention or constant medication. I developed a treatment that's not only safe and effective, but helps people avoid further surgical intervention, injections, and pain masking medications. And I'm here to talk about that today. The pain stops here.
Can you tell us a bit about how you created your successful method to help those who have been suffering from chronic spinal pain, neuropathy, joint-related pain?
Yeah, so my whole story starts with my grandmother. My grandma's a little old Italian lady that grew up right off the boat. She dealt with constant neck and back pain throughout her life. I spent a lot of time with her. We went to tons of doctor visits. She tried pain medication, she'd had injections, epidurals. She saw physical therapy, tried massage and chiropractic. For years, this seemed to do well of managing her pain. One day, we're eating Sunday dinner. My grandma had been having ongoing neck and back pain. It's been worsening, even with the pain medications and the therapies that she's been doing. All of a sudden, she has a coughing fit. With disbelief, we all look as we realize she's grabbing her back, screaming she hurt something, even a fracture or a break. An x-ray quickly showed that she had had 4 rib fractures and 2 what are called compression fractures in her lumbar spine. Now, the same doctors that we met with and spoke to about her pain that said she was managing her condition then told us that the medications and injections and therapies that she was doing led to her developing what was called osteoporosis. Her bones had demineralized, she no longer could take the medication, she was living in constant pain, which then related and turned into 2 fusions in her neck and back. I knew at that point that the medication and the therapies that she was doing were not fixing the problem, but masking them, and I dedicated my life to figuring out how to help people avoid that in the future and give them their lives back.
Wow. I mean, you would never think that something like that could happen in such a short amount of time.
Yeah.
We're taking all these medications, medications that seem simple, like Aleve and Tylenol, all the way to steroids and injections, and this can all lead to this outcome, and well, can that happen to anyone?
Yes. The unfortunate thing is it can. Medication always has a side effect, no matter what we do. Now, yes, alternative therapies can be safe, but a lot of times they don't help people. long term. But when we get into things like pain medications and injections, the thing we have to understand is what are the side effects of what we're doing. Even things like over-the-counter Aleve and Tylenol will actually lead to vascular damage and heart damage. These medications that we take are not fixing the problem. They're helping with inflammation. Well, if you're taking an oral steroid, like prednisone for example, or getting an epidural, what a lot of people find is they get some temporary pain relief. But what you'll realize is they can only give you that injection 3 to 4 times a year. Why? The reason why is because every time they give it to you, that injection is almost like an acid. It will help with your pain by overloading inflammation. But the problem is, the long-term effect is it actually further damages that tissue. It will result in the person having further issues, whether it's an advancement of their stenosis or their nerve condition, or even a potential surgery. The things do not have a long-term effect.
Well, I can tell you that I'm excited to hear more about your approach to care. I'm sure the folks at home are excited to hear about how you've come up with helping so many people to live the lives that they deserve. Tell us a little bit more about how you came up with this approach to care.
Yeah, so we have to talk about the human body. We all have pain, but it's not just one thing. The musculoskeletal system is a very intricate network. Think about it. You have your bones, muscles, ligaments, tendon, and your blood supply. All of those things work together to help our bodies tick. They help us sit, walk, bend, twist, even sleep. But if you think about it, when we have pain, there's a lot of different things going on. The nervous system, the joints, the muscles, they all work together. And when people have chronic pain, you have to treat that chronic condition from the root cause to where it ends. I had the opportunity to work with several different doctors, from radiologists to surgeons to neurologists, pain specialists, advanced surgical intervention. And what I realized was each one of these people were doing their job to work on a condition, but it came from an origin. And that's when I started to question, why were people not getting better when they were treating and trying everything they could to help these conditions? And that's when I founded my practice. My therapies and what we do are researched and evidence-based medicine. We brought together the most advanced treatments designed to help eliminate inflammation, improve circulation, help heal the nerve, reduce the arthritic inflammation, and most importantly, work on every attribute of that person's pain, customizing care to them with one goal: to give that person their life back, eliminate the condition they have, and let them live the lives they deserve.
So all of these body systems, they work together. Why is it these folks who you've treated, who've tried all of these other approaches to care, haven't been able to get better?
Yeah, so let's start by talking about something called peripheral neuropathy. This is a nerve condition where people are feeling numbness, burning, tingling, uncomfortable feelings in their hands and feet. When medicine first came about and started studying neuropathy, they thought that you had to be a diabetic. Well, with diabetes, the person has a sugar issue. The sugar damages the blood vessel, damages the nerve, or what's called the myelin sheath, and then in so, the person feels pain. That's what's happening with neuropathy. So the nerve itself is getting damaged, but then you start getting thousands and thousands of people who are coming in and they have numbness, burning, tingling. They have pins and needles, hotness or coldness that they feel, and developing balance issues, but they're not diabetics. So then they start realizing that there's something else going on. And these patients got called idiopathic neuropathy patients. Well, if somebody looks up that word right now, who's been told that in the past, you'll realize that idiopathic means that there is no cause. So now we're diagnosing somebody with, I don't know, diagnosis. I don't know neuropathy, idiopathic neuropathy. And really, there is something going on. There's a spinal related condition. Now with that person who has back pain, they could have stenosis, sciatica, disc bulges, herniations. They might not even have back pain at all. Many times I have a person that comes in who tells me that they have neuropathy in their hands or feet and they have balance issues, but they think their back feels fine. They live life normally. They don't think there's anything going on. And then what starts to happen is as we sit in conversation, we realize there's other things that have led to it. They've had previous bouts of back pain, it's gotten better and worse, and now we're talking about the whole story. The person is developing a condition that's progressing over a period of time, and now they're at the point where they are, where the pain is no longer acute, it's chronic, and our body's trying to figure out what to do about it.
So essentially, we think our back issues are gone because the pain is reduced, or the pain is temporarily gone because of medications, injections, creams, but we've only reduced the inflammation. We haven't really fixed anything. It's a short period of time that we've addressed.
Right, and for a lot of times, the patient is going and talking to the doctor, and we're trying different things. A lot of times, people with neuropathy, spinal, joint, or nerve pain are being given prescription medications. So we have things like Lyrica, Cymbalta, gabapentin, Lortabs, and hydrocortisones, which are more difficult to get these days. Well, if we talk about something like gabapentin or pregabalin, this is a medication that many are told are given for their pain. You have nerve pain, you have joint pain, you're having difficulty sleeping at night, we're going to give you gabapentin. The patient takes it, and they tend to find that they're not getting better. What they notice is that maybe they can sleep or it takes the edge off. Now, for those of you watching who might have heard of this medication, always ask, what is that? Gabapentin is an anti-seizure medication. It's actually designed to treat people with grand mal seizures. It has no relation to treating neuropathy. One of the side effects, actually, ironically, is it can cause neuropathy. So when we look into these things, we start to realize why people are continuing to live in pain. Now, Lyrica and Cymbalta are antidepressants. Once again, these medications are affecting our brain chemistry to make our bodies think that the condition isn't there. But then what starts to happen is even if we do get a little bit of pain relief, you might try to do life again. You're going to continue to do the things you want to do. You're going to walk, you're going to stand. And this little bit of pain relief or reduction in inflammation that you're getting is temporary. Because what starts to happen is the condition is worsening. The degeneration is getting worse. The stenosis is getting worse. And then what do? They're increasing our medications, increasing our injections, and the person's not getting that quality of life. The spine itself never has time to rest. So we're always dealing with this constant pain, whether we realize it or not.
So do you customize the care for the patient? And maybe can you explain to us how you use your treatment to stop the pain and even heal their condition?
Yes. So all of our care, first and foremost, is customized to the person that we're working with. A lot of times a patient will come into my clinic and they say, look, I've got arthritis, I have stenosis, I'm 82 years old, I have balance issues, I saw my doctor, and they said I have to deal with it. And I always look at them, and I smile and I laugh, and I said, so they said you're getting old, you're struggling with pain, and this is just something you have to deal with. And they go, yeah. And I said, well, what if I said that's not true? That's not the case. You know, when people have inflammation, it's from degeneration. We have arthritis, we all know that. But the problem is people are degrading because these things aren't being treated properly. The technologies and the treatments that we use are safe, they're effective. But a lot of times these things aren't cheap. And there aren't clinics that do this. This is something I've studied for a very long time. I've created this method of treatment, and then I started customizing it to the person I worked with. So when I sit down with patients, I look at their history, I look at their MRI, I look at their imaging, see what's going on with their body, and then help them get the quality of life back that they're looking for. My oldest patient is 103 years old. When I met her, she was 99. She came to me in a wheelchair. The first thing she said to me was, I want to walk again. And you know, being a newer doc and just having worked and utilizing my treatments, I am not someone to overpromise and underdeliver. So I looked at her and I said, look, I'm going to work hard for you if you're going to put the time in and let me take care of you. I saw her twice a week. We had her walking using an assisted walker, but we had her walking in less than 3 months. So even though somebody thinks they're old or they can't live their lives like this, it's not true. Most of the time, The reason why we have back pain and joint pain and nerve pain is degeneration. You know, it's not a car accident necessarily. It's not a major slip and fall. We're using our spines 24/7. We're sitting right now, we're talking. Well, guess what? Sitting is loading your spine at the highest amount of pressure. You do that for years and years and years and your core starts to break down, you're going to have degeneration in your low back. I'm sitting before you right now with a disc herniation in my neck, a disc herniation in my back. I've gone to surgeons who have told me that I need neck surgery because I have spinal cord compression in my neck. I have no symptoms. My hands work just fine. Same thing with my low back. That was from a car accident. I don't live my life in pain. Because I can manage it, I keep my inflammation at bay, I've healed my condition, and now I know what to do to take care of myself. And that's what I give to my patients.
You have invested your heart into your care, and it shows. We're going to take a short break, and when we come back, we're going to talk with patients and see some of these revolutionary treatments. Stay with us.
Has neuropathy pain begun to consume your life? Have you tried many therapies or medications without relief? If you have been told that there is no help for neuropathy, I promise there is relief from this condition. Don't suffer with numbness, burning, tingling, or balance issues. In order to understand how we can truly help you, I welcome you to attend our upcoming educational seminar. Schedule a consultation and tour the facility. Find hope with WNY Pain Relief and experience the difference today. 90% of our patients get relief in as little as one treatment. Call 650-PAIN.
Dr. Miliotto, this is the office.
Yes,
there's a lot here, a lot going on. So take us on a tour.
Yeah. So earlier we were kind of talking about each of our therapies, how they work to help somebody heal. So the most important thing to understand is how I explain how we work on body systems. So when people come in here, they're experiencing neck and back pain. They have joint and nerve pain, circulatory disorders. We're treating stenosis, sciatica, neuropathy. And we use several different therapies that are all researched and evidence-based to help that person heal. Now, every person that comes in here will always start with a tour with myself to explain how each therapy will be customized to their needs. So back here, we start with two machines here to the left and the right. These are called DRX 9000s. Spinal decompression therapy has been around for about 25 years. We've spent millions and millions of dollars investing research into proving the ability of this machine to eliminate the need for surgery and injections. Now with this therapy, this is going to help people with stenosis, sciatica, muscle issues, disc bulges, herniations, any type of muscle spasm or nerve pain that's coming from the neck into the hands or the back into the feet. Now this treatment is very relaxing. Most people will fall asleep, as you can see. The big thing about this therapy is when we utilize it, it's gentle but effective. So a patient that's coming in here, it doesn't matter if you're 8 or 80. My oldest patient was 103 and she was on that machine. This will use decompression therapy to take the pressure off the nerve roots. It'll improve balance, eliminate muscle and joint pain, and help with circulation. Now this is step 1 to our care. Now over here, this is our little rehab section. Back here, we have our whole body vibration and our hydro massage to the left. The hydro massage is everybody's favorite treatment. This is where we do a gentle, relaxing massage. It's heated by this box down here, and what it's doing is increasing circulation. The person, the only thing they care about is they're getting a really relaxing massage and they're enjoying the therapy. But for us, it's helping to get all of the metabolic waste out that we release with all of our therapies. The whole body vibration here is where we do balance and retraining. So if you have low back issues, weakness, neuropathy, we will use this treatment to help improve your balance, strength, and circulation. The massage itself is very gentle and relaxing. You can do the therapy while you're seated or standing, and through the progression, we will eventually get the patient to do more activity. Now today, we're just doing a relaxing circulation protocol. We just finished our nerve treatment. It's a nice way to end the therapy before we do the hydro massage. And this is what we have back here in our rehab section. If we come over this way, we've already had a few shots of our second therapy, but here to the left, we have what's called a NeuroMed. This machine is a very sophisticated device designed to actually eliminate nerve and muscular conditions. So if somebody is experiencing muscle spasms, they have sciatic nerve pain, this machine can be set up on almost any part of the body from head to toe to treat anything from knee conditions, joint and inflammatory issues, low back and neuropathy pain. each one of these treatments will be customized to the person that we're working. Now this is step 2 to our care. So this machine is used to address the nerve, the muscle, help with pain relief, and start to improve quality of life. Now at this point, what the patient will start to notice is they're moving, walking more comfortably, they have a reduction in their nerve pain, and each therapy will continue to enhance that. Most importantly, the person's not getting pain relief just here. They're experiencing the quality of life and the functional improvements at home. They start noticing they're sleeping better. Their 10 out of 10 pain is now a 7. And in a few short weeks of care, that person really starts to notice they're getting their life back. Now to the right here, we have a second neuromed. In this room right here, we have one of my favorite therapies. So this machine over here is called a Class 4 medical laser. And then this guy right here is called a LymphaTouch. Now, I have a lot of patients who have circulatory disorders, cancer and radiation treatment, lymphedema. This is the only machine that can actually help somebody with circulation and they don't have to wear those giant boots on their legs or go to sleep with them. I've worked with patients who have had spinal stenosis and swelling in their calves, and we've reduced and eliminated more than 50 and 60% of that fluid in just a few treatments. Now the Class 4 therapeutic laser here, and this is one of our 2 lasers, this is my favorite treatment. When somebody comes to the clinic, I always explain to them, I want to treat you, help you heal, get your life back, and never see you again. And by saying that, what I mean is we're here to help that person get their quality of life back. Now this machine here has several different treatments. Everything is customized to the person that we're working with. So for example, if I go to a protocol, you can see it's customized from the size of the patient, the level of inflammation, even their skin tone. Class 4 medical laser has the ability to penetrate into the spinal cord. So now we're increasing circulation and accelerating the healing process from the inside out. This is how patients heal and maintain those benefits. I can select the head, and you'll see we can treat headaches, Bell's palsy, TMJ, nerve issues into the shoulder, radiculopathy, arthritis. If you have cervical or spinal stenosis, when I select the low back, you will see we could treat anything from arthritis to sprains and strains, all the way down into the leg and foot. Now this laser in particular is one of my favorite because I have a lot of patients who come in who have already had surgery. Well, as you can see, there's even a post-surgical protocol. So now we can help with scar tissue and circulation. Many times a patient will come in and say to me, I've already had 3 back surgeries. How are you going to help me? And I explain to them how we will. Now, a lot of times patients come in and their expectations, as they've done many different therapies, are very low. And I always want to give them hope and have them realize there is an effect. We can help somebody heal. Now, our last therapy over here to the right is our 3rd and final treatment. This also works on nerves, but my patients who come in here have neuropathy, numbness, burning, and tingling. This therapy here is also designed to treat neuropathy, low back tissues, nerve and circulation protocols, as well as our 3rd and final Class 4 medical laser. Now this laser in particular, I have spoken about neuropathy a few times. This is the only laser in the industry that has a specific treatment for peripheral neuropathy treatment center here. These are all customized to the person that we're working with. So the nerve damage that they're feeling, we can treat from its source, which might be the neck or back or a joint, down to the hands, legs, and feet where the therapy ends. In conjunction, we will utilize these therapies, customize it to the person that we're working with, and most importantly, look for the goals and the outcomes they're looking for, not just pain relief.
Sherry's going to share with us a little bit about her back. About a month and a half?
About a month and a half.
And how is your progress in that
My
time?
progress is amazing.
I've been pretty much everywhere. For 6 years I've been dealing with this problem.
But you had not yet found the cause.
Yes, until I came here, and I felt a lot of relief in my neuropathy symptoms.
I was in the wheelchair, and then 5 weeks out of the year, I started walking.
Wheelchair that you have been forced to use since 2021.
Right. You know, instead of using the wheelchair in the house and stuff like that, I just got up, just making breakfast. I was kind of happy. I said, oh my God, it's working, it's working.
Unfortunately, I've got degenerative discs, and there's 4 or 5 of them in the lower back. As far as I'm concerned, he's given me my life back. I can do what I planned on doing. I can enjoy the grandkids again.
So I've spoken with a number of your patients today, and some of them have come from quite a distance.
Yeah, I have had patients from the start of my practice from Canada, 3 hours into Pennsylvania, Oswego, Jamestown, a lot of upstate New York. The reason why they come here is we're a clinic that design and customize these therapies. Not everybody does what we do. We know our stuff, we're effective, and we're giving people their lives back.
So people come because what you do works.
Yes, it works, and it gives them that quality of life and function they deserve.
It's amazing to hear from these patients and to see how far they've come with their healing. Doctor, tell us a little bit about your seminars and your consultations.
Yes, so I always offer free consultations. If somebody has chronic pain, they've suffered, they've tried everything, and they really feel hopeless, come in, sit down with me, and we'll go over your history together. You will see during the consultation that I will take the time to invest in you, to give you a tour of the clinic, show you the therapies, how they will work synonymously with your needs. We'll get a good history, look at your imaging, and put your story together. Doing that will give you the best opportunity to heal by utilizing our therapies, and then most importantly, educating the patient, understanding what your condition is, why it didn't get better, what we're going to do about it, and then how we're going to eliminate it. My seminars are an educational opportunity for anybody looking to understand why they haven't gotten better. Maybe you don't feel comfortable sitting down with the doctor yet. Maybe you want to know more about what's going on or what these conditions are. My seminar is designed to educate patients on these technologies, on the researched and evidence-based medicine, why you're not getting better, why your neuropathy is worsening, and most importantly, why you may have told you had to live with it when you didn't. That's what it's all about.
Dr. Miliotto, what would you say to someone sitting at home watching this program right now who's suffering from chronic pain issues?
If you're suffering from chronic pain, don't wait another moment. Give us a call. Know that there's a team of doctors, therapies, and true healing that you can obtain. Remember, an opportunity is here and your pain can stop for good.
Have you continued to suffer from chronic neck or back pain after trying everything? Do you suffer from peripheral neuropathy and have been told you have to live with it? If so, call now to attend WNY Pain Relief's upcoming seminar and learn how you can once again have hope for true pain relief. You do not have to suffer sleepless nights, balance issues, numbness, burning, or tingling. Pain from sciatica, stenosis, arthritis, and disc herniations can be eliminated. Call now, attend the seminar, and see the unique difference with us. Call 650-PAIN.